Hi, I'm Dr. Tim Lind, and today I'm going to talk about a common topic that I hear from a lot of people, either through email or phone calls or even when I consult with them, and I call this thyroid frustration. And what I mean by thyroid frustration is um, people are frustrated. They'll be talking with me and telling me kind of what's going on with them, all their symptoms, whether it be their hair loss, or they can't lose weight, or the gut disturbances, or the depression, or the chronic fatigue, or the insomnia. They got all these different symptoms, thyroid symptoms, and they'll go get their thyroid checked, and they'll go, no, your thyroid's normal, it's not your thyroid, you're okay. And it's very, very, very frustrating. And what people think or even say, they go, well, why do I feel so horrible then if my thyroid's okay? So we're going to address that here today. So if you look at this screen over here, and I know you're not going to see it too terribly well, but bear with me. I call this the physiological web. And in the center being your problem. And so your problem in the center there, we're going to call that your symptoms that you may have. Okay? And if you look at this, all of a sudden it gets a whole lot more complex than just I got low thyroid. Okay? Now it may be that. Actually, it wouldn't be that, because if you did have a thyroid condition, you took thyroid medication, whether you put on Synthroid or levothyroxine or Armour or Cytomel or any other thyroid medication, if that were to make your symptoms go away, then it would definitely be a thyroid problem. It's called primary hypothyroidism. Okay, but a lot of people I see are on these medications and they still feel horrible. Okay, and this web is all interconnected, and we're not going to go into great detail, but the purpose of me showing this to you is it can get very, very, very complex. And what I mean by that is I have seen patients in my office, their thyroid symptoms and thyroid problems are caused by, let's say, blood sugar imbalances in the upper left. Okay, or it can be caused by liver dysfunction, which is in the lower right, or it can be caused by adrenal dysfunction or gut. My point is they are all interrelated. And I know you can't see the little green circles there, but they are also subsets of different problems that go along with this. So all of a sudden, a very simple problem of low thyroid gets very, 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 very complex, or your symptoms, whatever that may be in the middle. So what needs to happen here is we need to find out where the problem's coming from. Okay, you do need to address the thyroid, but you need to address the blood sugar. You need to look at the liver function and possibly adrenals. There's so many other factors that are involved with this, and if they're not addressed, you're going to be in the same situation you're in, which is square one. So the way I like to deal with things is you look at somebody as an individual, you get all this information, you bring it all together, and you find out what is going on with them specifically so that can be addressed.